Hello, I'm Dr. Maria Suarez-Almazor, a professor at the University of Texas MD Anderson Cancer Center and the Chief of Rheumatology and Clinical Immunology.
Hi, and I am Dr. Pundole, and I'm an instructor in the section of Rheumatology and Clinical Immunology at the University of Texas MD Anderson Cancer Center. We are going to talk to you today about our research, which was recently published in the Journal of Immunotherapy and Precision Oncology. As you may know, the treatment landscape of cancer has changed dramatically in the last couple of decades with the development of immunotherapeutic agents. One such group of agents are called immune checkpoint inhibitors, which boost the body's own immune system to fight cancer cells. Despite their unprecedented efficacy, these agents can cause adverse events, which are generally referred to as immune-related adverse events, or IRAEs. The full spectrum of IRAEs is still unfolding, and hence we conducted this study to identify and describe rheumatologic and musculoskeletal IRAEs by analyzing the FDA's Adverse Event Reporting System database. We used AIRSmine, which is an open-access, web-based, comprehensive data mining framework which analyzes millions of reports of patient data submitted to the FDA. We analyzed data from the first quarter of 2011 until the last quarter of 2018, and we restricted our analysis to patients with a cancer diagnosis. What we found was that there were several rheumatologic and musculoskeletal IRAEs reported. The most frequently reported IRAEs were arthralgia, myalgia, followed by myositis, arthritis, and so on. We also identified IRAEs such as sarcoidosis, Sjogren's syndrome, and systemic lupus erythematosus. Of importance, what we found was several novel skeletal-related IRAEs, and these included fractures of the upper limb, lower limb, hip, spine, and other anatomical locations. In general, these IRAEs were reported in relation with anti-PD-1 inhibitors. We also found other bone-related IRAEs, including osteonecrosis of the jaw, osteitis, osteomyelitis, and others. Overall, what we saw was the number of reports were greater in respect with anti-PD-1 inhibitors compared to anti-PD-L1 and anti-CTLA-4 immune checkpoint inhibitors. We analyzed both monotherapy and combination therapy, and what we found was that patients receiving combination therapy had higher relative risks and safety signals compared to those receiving monotherapy.
Our study is the first one to comprehensively analyze the United States FDA Adverse Event Reporting System database to identify and describe rheumatologic and musculoskeletal immune-related adverse events following treatment with immune checkpoint inhibitors. Our findings can have some limitations based on the nature of the FDA database. Events are reported spontaneously and do not require validation from healthcare professionals, so a causal relationship cannot be established with certainty. Despite these limitations, pharmacovigilance data are useful in describing the spectrum of possible immune-related adverse events and directing future research. For further information, please refer to the full text published in the Journal of Immunotherapy and Precision Oncology. Thank you.